Most likely, dementia doesn't increase risk for COVID-19, the respiratory illness caused by the new coronavirus, just like dementia doesn't increase risk for flu. However, dementia-related behaviors, increased age, and common health conditions that are often accompany dementia may increase risk. For example, people with Alzheimer's disease and all other dementia may forget to wash their hands or take other recommended precautions to prevent the illness. In addition, diseases like COVID-19 and the flu may worsen cognitive impairment due to dementia. Well, a research scholar in brain health and an artist, Kunle Adewale, who has been helping senior citizens living with dementia in the United States during COVID-19 to cope with loneliness, depression and anxiety and social isolation through arts, joins me now live from San Francisco. Good to have you on the World Now this time. So tell us more about this initiative and how impactful it has been to the seniors.
Thank you very much. I'm grateful to join you guys today, all the way from San Francisco in the United States. The COVID-19 pandemic has really affected both young and old, and black and white, people from all walks of life. And the seniors in the United States are not left behind. Before this time, these seniors are people who are living with cognitive impairment. Actually, some of them are in care homes, some of them are in nursing homes. But when this pandemic happened, so there's a lot of restriction, and some of them probably who really do not go to nursing home or care homes are actually, in their various homes. So in a way, there's a huge disconnect, there's a huge social isolation, and now there's so much depression. And so what I do basically with them is using art-based intervention, using technology as a means of vehicle of connecting with them by using Zoom and creating, live art workshop with them where they are able to create works of art based on their experiences. And this has really brought so much joy and happiness to their homes, to their lives. And I've seen all of them, having so much joy, and then their faces have been, ignited in a way, lightened up. So as opposed to what is happening around now, so ever since they've been involved in art making process with me, it has always been a moment of joy and happiness for them.
Indeed, quite a moment of joy and happiness for the senior citizens now. But interestingly, we understand you're a research scholar in brain health. Tell us why you are using art for this.
So, as an artist, even when I was in school in Obafemi University, where I studied fine and applied art, my major was art history and painting. We were never taught about the connection between art and neuroscience. We were never taught about art and brain health. So, and then I realized that, and there's so much huge gap in knowledge on what we do back home in Nigeria, what we do back home in Africa, as opposed to what is happening in the United States and developed countries in the world. So what I'm doing now is to start thinking of innovative ways of connecting with seniors who are really suffering from cognitive impairment or cognitive decline, and how art can be used for their cognitive well-being, how art can be used to stimulate their minds such that things that they can't do before, they can start doing it again. Art just helps to reawaken that part of their lives that is really shut down because of the disease. So it has been a progressive journey working with those with dementia and those with Alzheimer's, because I know that there's low awareness on Alzheimer's in Nigeria. So I think one of the ways of doing this is using art-based interventions to create awareness on dementia in Nigeria, and that way also thinking of ways to support professional caregivers on how they can support these seniors they are working with, and also NGOs that are working with those who are living with dementia in Nigeria. So thinking of how to use creative engagement to really support them in their journey, to help them to become more lively, to become more responsive, to become more active, to become, more, how do I put it now? To be more enthusiastic about life, because dementia really puts people in a bad place. And art, I think, can really bring light into their lives and lighten them up and give them reason to hope and have joy again.
Indeed, having joy again, that's the spirit. But talking about coming back home in Nigeria, which you mentioned earlier, what level of support have you been getting from the state government to help its senior citizens at this time?
So what I would say basically is that, I mean, even when I started my program back home in Nigeria, my focus was more on pediatric oncology, pediatrics. So I work with a lot of children, I work with a lot of young people, girls and women. And sometimes we've received funding support from diplomatic missions like the U.S. Mission in Nigeria and also the U.S. State Department. And also maybe a partnership with Gabby Williams Alzheimer's Foundation in Nigeria. But unfortunately, there's no funding for the art-based intervention that we do in Nigeria. So sometimes I use my personal money to run program for these people. And so we've not really have any support from state government or federal government at all in doing what we're doing. So I look forward to support from the community, from the state government, and from the federal government, because we really need to care for our seniors. The way we treat our seniors and elders in Nigeria is very unfortunate. We treat them with so much dishonor, and we really do not have dignity, sense of dignity for our seniors and elders in Nigeria. You know, many people today, the parents that care so much for them, the parents that sacrifice so much for them to get them to where they are in life today. Some of them, unfortunately, are left behind because now we are now more ambitious. We are now having career to pursue, and then we just leave these people in nursing home, and then sometimes the nursing home feel like a prison yard for them. These people sometimes don't want to be in the nursing home, so it feel like a prison yard for them, where they just feel like life is over for them. So they become more aggressive, they become more depressed, they become more, in a way that is not really helpful for them in their personal life, emotionally. So there's so much we need to do on how to really help seniors.
Yes, indeed, so much to do to help our seniors. But tell us a little bit about your experience helping some of these ones while you're in the United States.
So what I've been doing ever since I've been in the United States, I, as a research scholar in brain health through the Atlantic Fellowship Program of the Global Brain Health Institute at the University of California, San Francisco. So I am the leader for the art-based intervention for seniors in San Francisco neighborhood. So I've been using Zoom form of connection to these people who are really left at home. And so we've been doing paintings, creating and drawing and exploring. So I do that through Memory and Aging Center at the University of California, San Francisco. And in addition to that, I also partner with Alzheimer's Association of Northern California and Northern Nevada to be able to facilitate what I call virtual art for seniors. And so when the pandemic happened, so I reached out to these Alzheimer's Association in the United States, and I told them about what we can do on how to support the population they are serving. And ever since, it has been an incredible journey using art to inspire joy, to inspire hope. And I've seen these people in a way that they have become more responsive to life, they have become more joyful. And then even when we create art and make art, sometimes some of them after our art classes, they go back to continue to make works of art, they continue to stay engaged. And that way their life has really improved. So art really improved the quality of life of the people that I've been working with in the United States, those who are living with dementia, those who are living with Alzheimer's disease. And so for me, this is very fulfilling. This is something that I've always loved to do, to give back to the society, and to be able to improve the quality of life of people around me. And I'm glad I'm also doing it here in the United States.
All right, and that's a good one indeed from you. Thank you very much, Kunle Adewale, and we hope more of this will help our senior citizens here in Nigeria, of course, elsewhere. Thanks a lot for your insights on TVC News.